5 minutes on the clock for your reading time, and your time starts now. Case 3. Candidate Information. Instructions. You have 15 minutes to complete the case. You should treat this consultation as if it is face-to-face. A patient record summary is provided for your information. Perform the following tasks within the case time. 1. Take an appropriate history from the patient. 2. Outline key features you will look for in examination. 3. Assuming the examination is unremarkable, outline your differential diagnosis. 4. Provide appropriate management advice and address the patient's concerns. Scenario. Eilert Venner, 35 years, presents with concerns about lower back pain and difficulty getting pregnant. Patient record summary. Patient details. Name, Eilert Venner. Age, 35 years. Gender, female. Gender assigned at birth, female. Indigenous status, not Aboriginal or Torres Strait Islander. Allergies and adverse reactions, nil known allergies. Medications, multivitamin daily. Ibuprofen as needed for pain. Past history, recurrent urinary tract infections. Mild scoliosis diagnosed in adolescence. Social history, lives with partner James, married for 3 years. Family history, mother has osteoarthritis, sister has endometriosis. Vaccination and preventative activities, up to date with vaccinations including HPV and influenza. And your reading time is up. Your case time starts now. Oh, hi, Doc.
Hello, Elliot.
Yeah,
How you going?
I've been getting this back pain for a few months now. And my partner and I were hoping to get pregnant, and I'm just, a bit worried about it all.
Sorry to hear about it. Um, Bit of an interesting combination, back pain and inability to get pregnant. Um, can you tell me anything more about what's been going on?
Yeah, we'll start with the back pain. I guess it's been going on for kind of 6 months now. It's a kind of achy pain that just mostly in the kind of lower back.
Mm, okay. Um, has anything happened 6 months ago that brought it on?
Not that I can think of. Just kind of
You didn't,
started creeping up one day and just kind of getting worse since then.
no falls, trauma, getting hit, nothing like that?
No, not as far as I'm aware.
Okay. Have you ever had a back pain like that before?
No, nothing like this, and nothing that's
Mm,
kind of gone on as much like this has.
right. And have you changed jobs or started doing something more physically exertive that you think could have brought on muscular pain?
No, I mean, I'm still in graphic design, so I spend most of my day kind of sitting down and sitting in the same position, really.
Mhm. Okay. Has the pain been moving anywhere other than your lower back?
No, it doesn't move anywhere. There's no kind of,
Doesn't shift into your legs or anything like that?
no,
Okay. Have you noticed any changes in your legs at all? We're talking pins and needles, numbness, weakness,
no, nothing like that.
any changes to your bowels,
Bowels are pretty normal.
constipation,
No,
and
usually
how about
kind
your
of in the
belly?
morning. No, that seems okay as well.
Have you been having any fevers for no good reason?
Not that I can think of.
Night sweats?
No,
Losing any weight without trying to?
no. Pretty much been this weight for the last kind of 10 years or so.
Yeah, right. Okay. And what do you think brings the pain on when it does happen?
Well, usually if I am kind of sitting for a long period of time or even when I'm standing for a long period of time, kind of not moving seems to make it worse, I think.
Do you feel like it's worse in the morning, gets better through the day, or the other way around?
Um, well, probably neither really. It just seems to be, relatively constant.
Do you feel like it has any relation to your menstrual cycle?
Kind of hard to say because it's just kind of always there now. Maybe early on,
Okay.
maybe a bit worse around my periods, but
Yeah. Okay. Do you get any pain, any burning, stinging when you piddle, when you wee?
no, nothing like that.
No. Okay. And does the pain shoot to the sides at all, or is it just in the back?
Kind of in a kind of band across the back.
Mm-hmm. Does anything make it better?
Usually take some Nurofen. That kind of takes the edge off. Been trying to do some like yoga and Pilates kind of stretching kind of thing, and maybe that was a bit effective at the start, but it kind of seems to have worn off now.
Mm-hmm. Do you want to tell me a bit about the difficult getting pregnant stuff?
Yeah, sure. So, well, we've been trying for a while now, and it just doesn't seem to be happening, to be honest.
Mm.
I've never been pregnant before, so it's all kind of new, but I think we're doing everything right. I mean, how long's it supposed to take?
Mm. Well, how long's a piece of string? Look, have you ever had uh, any miscarriages or abortions?
No, nothing like that. Never been pregnant before.
Do you mind if I ask you a bit more about your periods and stuff like that?
Yeah, sure.
How old were you when you had your first period?
I was 9.
No, fine, okay. Um, are you still having regular periods nowadays?
Yeah. I use an app to track them, and it's pretty much every 28 to 30 days, pretty much on the dot.
Mm-hmm. How many days do you bleed for?
Usually 5 or 6 days. That's been pretty consistent.
Is the pain really bad when you have your period, or is it pretty manageable?
About the same as it's always been. I get a lot of
And,
pain, but again, usually have some Ponstan or Nurofen that usually gets on top of it.
mhm. And is that period pain different from your low back pain? Is it the same pain?
I guess kind of feels similar, I guess, and kind of deeper. I guess the period's a bit more crampy. The back pain's kind of just more constant ache.
Mm. How long have you been trying for a baby now?
Yeah, it'd be about a year now, coming up to 12 months.
Okay. And can be a bit of a on the nose question, but have you been having intercourse around midway between periods of bleeding at least a few
Pretty much
times a
every
week?
chance we get. Yeah, a couple of times a week,
We
2,
get.
3 times a week.
Yeah. Yep. And there's definitely ejaculation in the vagina when that happens. Sorry for the terminology.
No, that's fine. Yeah.
Yep. Have you ever had a sexually transmitted disease?
No, nothing like that. I've only had 2 partners in the past, and yeah, nothing like that.
Any bleeding when you're not having irregular period bleeding? Any irregular bleeding or spotting during the cycle?
No,
Any vaginal discharge that was there before? Something unusual?
no, nothing that I've noticed.
Do you get any pain on deep penetration?
Not particularly, but it's not really much of a issue for a couple.
Nice. Again, a bit of on the nose question, but you're not using any contraceptive device?
No, really keen to get pregnant. So yeah, not doing anything like that.
No worries. Have you been having any unexplained headaches? Just random all of a sudden?
No,
Just bear with me. So.
it's okay. Well, the nurse said you might want to do some examinations. Was that right?
Certainly, we'll get to that in a little bit.
Yeah, sure.
Do you drink alcohol?
Maybe socially, but I've been avoiding alcohol except when I get my periods since we've started trying.
Mm. Any recreational drugs at all?
No, nothing like that.
Okay. Do you smoke?
No, never smoked.
Okay. And physical activity, any exercise day to day, gym, whatnot?
Yeah, I try and go for walks kind of 2 or 3 times a week. I do some light yoga. Tried some Pilates recently, but back pain kind of stopped me.
Fair enough. Any allergies to anything?
No, not as far as I know.
Or delisted? Oh, good. Okay. Look, I might move on to the examination part. Okay. I'd like to check the observations, the heart rate, blood pressure, respiratory rate, and just how the patient looks.
I presume everything's normal.
Good. We'll check the body mass index, height and weight.
Yep. BMI is 24. Height weight normal.
Yep. I'll have a feel your abdomen, please. I'm just going to have a look, then listen with a stethoscope for bowel sounds, then palpation of the 9 parts of the abdomen, lightly and then deeply, please.
Everything's normal.
Everything's normal. Might incorporate a pelvic bimanual palpation with the female inertia front present, if that's available, please.
And no unusual findings.
Okay. Ayelet, are you up to date with your pap smears, the cervical screening tests?
Yeah, I think my last one was 2 years ago, and I've never had an abnormal one.
Let's have a quick listen to your chest and heart, please. Heart sounds and
Yep, all normal.
Right. Neurological exam, lower limbs. I would just test light sensation below the knee and power, hips, knees, and ankles.
All normal.
And let's have a look at your back. Just palpating paraspinally and spinally for any tender spots.
And no pain?
And is there any asymmetry?
Not noted.
Skin change in lower back? Do you mind if we do a urinalysis on the bedside, please?
Normal?
And a finger prick sugar, please.
5.6. So, doctor, what do you think's causing my back pain?
Yeah. Well, look, like I said, a bit of an unusual combination of things. Back pain's got quite a wide differential for what could be causing it. A lot of things can happen elsewhere in the body, and the pain can radiate to the back, and you get a back pain, but really the problem's somewhere else. I'll go through what my thought process is with you, but what I think is most likely, less likely. So musculoskeletal cause of the lower back pain are the most common things. We're talking about muscle sprain, we're talking about ligaments that connect bone going under sprain. It's unlikely that you've broken any bones there, given there's been no trauma. I don't think any nerves are pinched in your back. Sometimes that can happen when you have a slip disc, and then you get sharp pains into your legs. Some of the less common things that can go into the back: cancers, infections, things like that that cause weight changes, fevers, night sweats. Problems with the organs inside your belly, like your ovaries, your uterus, your bowels, liver, gallbladder. All these can refer pain to the back. But it doesn't look like that's the case for you. Some of the more rare things, autoimmune disease, sometimes anxiety, depression can also manifest as back pain. In your case,
my sister has endometriosis, and I'm worried if that could be it.
yeah,
If that's related. Do you think that could be the case?
yeah. So getting to that, apart from musculoskeletal things, which I think are a probable differential for connecting your back pain with your inability to get pregnant, and you telling me that the pain you get day to day is similar to the pain you get during your periods, endometriosis is possible. Connecting diagnosis for both things. Endometriosis, do you know much about it?
Yeah, just bits and pieces from what my sister said.
Yeah, so the lining of the uterus right on the inside, the bit that bleeds every month, if that stuff starts growing outside the uterus, sometimes on the bladder, on the bowels, in there, it can cause a lot of pain and sometimes a lot of bleeding during a period and in between your periods. And that can also cause you to have difficulty having babies. Okay.
What can I do to try and increase the chance of having pregnancy then?
Yeah, so if you've got endometriosis, that's something we need to check for first. First thing we should do is we should send you for an ultrasound scan. So that kind of scan where they put a bit of gel in your belly and they scan your organs, your ovaries, uterus, and they also want to do a scan through the vagina at the cervix. That gives us the best definition of the uterus. And to look for those little deposits of the endometrium around your belly, okay?
Yeah.
Does that sound like something you'd be able to go for?
Yeah, I'll do anything if it gets me pregnant. And
yeah, no,
my mum was saying that sometimes it's not me. Do you think my partner needs to come see someone as well?
Oh, for sure. So standard infertility testing for a couple, most of it's done by the female, but your partner will need to see their own GP and do a sperm analysis. Basically, they shoot some guys into the little jar, and then the pathologist looks at it under the microscope, make sure all the guys are swimming in the right direction and they're all active and there's enough of them there. Yeah.
Okay. I'll have to talk to the guy book in to see his GP then.
Yeah, you definitely will need to. Did you want me to tell you a bit about my thinking on the getting pregnant, or?
Yeah, that'd be great.
So other things that are less likely in your case, polycystic ovarian syndrome, that's something that's likely in people with a higher weight. There's some weird tumors that can happen in your brain, but prolactinoma doesn't sound like that's happening with you. Some people have a low thyroid gland. That's something, low functioning thyroid gland. That and the prolactin is something you could check on the blood test.
And I'll interrupt there. That is time.
Shit.
15 minutes goes fast, sorry.
Yeah.
How do you feel?
Yeah. I didn't get through the
Okay.
netting and all
That's okay. I think you still did well. I could see the directions you were heading in. You're quite good at that kind of signposting, so that was good there. So again, going through the kind of feedback here is, again, getting the details of the history, and I think you did well there. You got pretty much every point I had to give you. And I think you did a good job of exploring each one individually and then coming back and kind of saying, okay, well, if these are related, how might they be related as well? This is, again, another kind of free mark is the kind of social context and just acknowledging the frustration that comes with people that are having difficulty conceiving. Just a quick kind of, that must be really difficult. I can appreciate this is something that's really hard for you. Ticks the box. Also, just good for building rapport. Now, in terms of kind of the underlying gynecological issues, you kind of ticked all the boxes there in terms of she needs to get an ultrasound done, as well as some other testing there as well. You had a good approach to kind of going through what kind of examinations you would be doing. For the actual exam itself, though, you wouldn't be getting that feedback of normal. And part of that comes back to the original stem of presuming everything is normal. So in that case, they've already kind of told you. So one way to also save yourself a bit of time, when they're asking, what examination would you be doing, you can just kind of rapid fire. I would be doing this, not having to pause to get the feedback there. That's, again, just kind of the artificial nature of the exam. The next thing, as you appropriately did, was to kind of acknowledge, hey, if this is related and we need to be talking about subfertility or infertility, given they're coming up to that 12-month kind of cutoff, then going through for a gynae review, as you said, and making sure as well the partner gets tested. There is that prompt there at the end for, hey, does my partner need to get tested? And the answer is yes. I liked as well, you kind of said, well, what are we dealing with here? Musculoskeletal, most likely. Endometriosis, fantastic. You also touched through, could be other more rare things. So I think you kept some of those on the radar, and I thought that was done quite well. You, I think, came up with very sensible imaging options in terms of ultrasound, which is the preferred one for this. And the next thing you could have probably touched on, although I think you're probably about to, but ran out of time, is physiotherapy. Yes, she's doing yoga and Pilates kind of things, but a more kind of structured exercise or stretch program linking in with the physio can be really, really helpful. Now, I haven't seen in chat, or at least no one's put in there yet, but is there any other kind of red flags that leap out at you about this case? I'll give you a hint. What's she taking for pain relief? Was lots of NSAIDs. And NSAIDs are not great for pregnancies. So something that you would have to, that's all right. Something you would have to explore is, hey, it might be worth coming off the non-steroidal anti-inflammatories and seeing if that doesn't actually change conception.
Right.
Again, as you said, kind of ran out of time at the end there, but putting in that follow-up plan and safety net, we'll do these tests. We'll bring you back after a week, 2 weeks, or really depends on how long it takes to get an ultrasound wherever you're working, and go from there. Excellent. Any questions at all?
Nope. Thanks, mate.
Anytime. And thank you for jumping in as well. I'll leave you to it then. I'll let you log off. Have a great rest of the night.